Professor Davis here. We're going to now dive in medical terminology to the peripheral nervous system with the focus of the special sense organs. So let's talk a little bit about the function. The function here, we're going to be looking at receptors. The receptors are the sensory nerve endings that respond to the stimuli. Now, these receptors can be what we call more general receptors, like we see in our skin for touch, temperature, pain, or they can be special sense receptors like we see in our eyes called rods and cones, okay? So some of our special senses have special receptors. Now with this, the sense organs are going to be the receptors that detect the sensation. They then transmit that sensation towards the central nervous system. The central nervous system then interprets it as sight, hearing, touch, taste, and smell. So what is a sense? A sense is how stimuli are perceived, whether you perceive it as hot, cold, pain. So the first one we're going to focus in on is the eye. So the eye, the main function is for vision. So this is where you see the root word ochleo that's going to play a big role here. The eye and the adnexia are responsible for an individual's sense of vision by capturing and focusing light rays onto the retina. And the retina is going to have the sensory receptors present. The interpretation of these images that you bring in are going to ultimately be done by your nervous system, the brain specifically. The eye or the eyeball is a bilateral structure, so you have one on each side. The oculus sinistra or OS is going to refer to the left eye, whereas the right eye is known as the oculus dextra or the OD. If medication is required in both eyes, each eye, the notation has oculus uterque, which is being both eyes. We do see that the Institute of Safe Medical Practice has designated the abbreviations of OD, OS, and OU as dangerous abbreviations, and so it's recommended to write out the full terms instead of using the abbreviations some of these times because they could be a little bit confusing. The ocular accessory structures are the structures outside of the globe of the eyeball, and they aid in the acquisition of vision. And so guys, the whole point here of the eye is again to focus in on whatever you're viewing, make it focus onto the retina. The retina then sends a signal to the rest of the brain. So let's look at some of these structures, okay? So we have the outer accessory structures here in this very first picture where you have things like the lacrimal glands, which are the glands that are going to produce tears. You also have the excretory ducts, which put these tears onto the eyeball. These are then going to drain through the nasolacrimal sac down into your nose. You also see that you have the pupil. The pupil is the dark circular structure in the center of the eye, and this is where the light rays are going to enter the eye. It's actually a hole. The iris is the colored portion of the eye. This could be blue, green, brown, gray, and so on, depending on the person's color. We then have the sclera, which is the tough white kind of opaque membrane that covers the entire eyeball. We also see that if we take a closer look at the eyeball as a whole, like not just the outside structures, if you look in, we do have things like the cornea. The cornea is going to be the refraction of the light. That's what it does. Refracts it through the pupil and onto the actual retina. The choroid is the blood supply, and so this particular layer of the eye is inside of the sclera, and it has lots of blood vessels present. There is an area here that is called the ciliary bodies, and this is a secretion of vitreous fluid. It helps change the lens shape as well. We have an external ocular movement of the globe muscles. So there's 6 muscles that move your eye, allowing you to move it in all different directions and also to blink. The eyelid is the projection of the skin that then covers and allows you to move the tears across the eye and wash it as you blink. We already talked about the iris, we talked about the pupil, we talked a little bit about the lacrimal glands. The lens itself is going to help again with the cornea for light refraction. This refraction is on the innermost layer of the eyeball, which is called the retina. This transforms optic signals into nerve impulses, and it does this through the use of rods and cones. Rods help you distinguish light from dark and perceive shapes and movements, whereas cones give you color or very precise vision. And we do see that the retina is going to be where the optic nerve is also located, and this is what transmits the visual information to the brain. The optic nerve is known as cranial nerve number 2. So let's take a little closer look at the retina. So when we talk about the rods are more for your peripheral vision, so from the sides, your night vision, and for motion. The cones are going to be the color vision, and so this is allowing you, cones are going to be in blue, green, and red colors. They're responsible for your normal color vision, and also they're responsible for the very clear and crisp vision that you have. Problems, though, with these could include daltonism, which is a weakness in seeing colors distinctly, usually affecting either the green or red cones. And then we also could have color blindness, achromatopsia. So there is a difference here when we talk about an ophthalmologist and a optometrist. An ophthalmologist is a medical physician that specializes in eye pathology. So they're the ones that you would go to more for actual the pathology or issue with the eye, like infections, things like that, where an optometrist is not a medical physician, but they do treat visual problems. They treat things like nearsightedness, farsightedness. They're the ones that help us be able to get glasses, contacts, that sort of thing. But if it goes into the scope of more of pathologies of the eye, an optometrist would refer you to an ophthalmologist. So let's look at some eye combining forms. We have the coracoid, which is the coracoid, the blood vessel layer of the eye. Conjunctivae is dealing with the conjunctiva, which is a layer of tissue that's on the sclera and it has blood vessels as well. Conjunctivitis is when that gets inflamed, and we call that pink eye. Corneo or kerato, which is the cornea. Iro or iridio, which is iris. Lacrima or decyro, which is tear. Ocleo or ophthalmo is the eye. Opto or optic is for vision. Pupulo is pupil. Retino is retina. Chromo is for color. So we talk about like chromatography is going to be looking at the color. Presbyo is going to be old or old age. And tono is tone or tension. Okay, so these are some of the combining forms that you'll see with some of the terms for the eye. All right, so diagnostic types of procedures that we see with the eye. We have examples where we would use the Snellen chart, which is the eye chart. It starts with that giant E, that big O E that most people are able to see, and it goes down into smaller letters that the eye doctor will ask you, can you read these letters on this particular line? This is a common method of determining clearness of vision and seeing what you might need nearsightedness or farsightedness when we talk about the picture that we'll look at in a second. Ophthalmoscopy is the next one. In this particular case, it's a visual exam of the interior of your eye. We also have the fluorescein angiography, and this uses a bright green fluorescent type dye to examine the blood vessels and the vessels in the eye, making sure that they are sending blood and taking things away correctly. And then we have tonometry, which is going to be to test the measure the ocular pressure, so the pressure, the intraocular pressure of the eye. And so these are all tests that you would do when you go to the eye doctor. Okay, so they would do all these different tests in order to see if you've got an issue. So an example here in this picture, you'll notice that the normal vision takes the picture you're looking at and it puts it directly on the retina. It focuses it on the retina. But if you look at the hyperopia, it's going to be, it focuses it behind the retina. This is obviously going to give you blurred vision. We also see myopia, the same thing. It puts it too far forward, blurring up your vision. And when we look at astigmatism, it gives you multiple of that particular thing you're looking at. And so there's a lot of different things that the eye doctor would help us to be able to look at to help correct. And this deals with a lot of times when we talk about nearsightedness, farsightedness, astigmatism, they all fall into that. So let's talk about some of the pathologies here. So the first one is amblyopia. Amblyopia is also known as strabismus. This is where there's reduced vision in one eye that is not correctable by glasses, but by wearing like an eye patch. And so if there's like a crossing of the eye, an issue, an eye patch can help with this. Ophthalmoplegia is going to be a hemorrhage from the eye. That's where there's going to be bleeding from the eye. We have a cataract, which is an abnormal progressive condition of the lens of the eye where it starts to kind of fog up in a sense. It starts to be where you're not looking through actual like saran wrap, you're looking more through wax paper with a cataract, and the opacity starts to change. Glaucoma is an abnormal condition of increased pressure within the eye. So prolonged pressure can damage the retina and the optic nerve. Several drugs and laser surgeries may be used to help relieve that pressure from glaucoma. Blepharoptosis is the next one, and in this case, this is also known as ptosis. It's an abnormal condition in which one or both upper eyelids droops. When we look at this, it can be congenital or it could be acquired as a result of a weakness in muscle, like with aging, or if there's paralysis of like the facial nerve in Bell's palsy. We also see retinal detachment. This is a separation of the retina from the back of the eye. Now, this is not painful at all, but it is going to be a medical emergency. We need to get it looked at because this could cause damage to the vision permanently if we do not get it taken care of. We also have diabetic retinopathy. This one is going to be where there's abnormal issue with the retina that's caused by diabetes mellitus, uncontrolled blood sugar. Macular degeneration, or MD here, is a progressive deterioration of the retina. This is associated with new vessels forming, causing issues. There's a wet kind of macular degeneration and a dry, but they still deal with the blood vessels. Conjunctivitis is inflammation of the conjunctiva, also known as pink eye or red eyes. And then we have nyctalopia, which is poor vision at night or reduced light, causing you to have like kind of almost like night blindness in a sense, where you can't see as well and drive as well at night. It affects your night vision. Some surgical interventions when we talk about the eye would be a blepharoplasty, which is a surgical repair of the eyelids. It does correct that drooping we talked about just a minute ago. Corneal abrasion is a scraping away of the outer layers of the cornea. This could be done by using a laser or even a special scalpel. We can use laser retinal photocoagulation. In this case, it's used to stabilize a detached retina. They use a laser to make pinpoint kind of scars to tack down the retina so it doesn't curl up and detach. We also have LASIK, which is laser assisted in situ keratomiliolysis, which is going to be this abbreviation for LASIK surgery. This is a corneal surgery where they use a very specific laser to kind of take off small layers and kind of reshape to correct myopia. Okay, so we see that that's going to help with vision. This is to help prevent the need of glasses or contacts, this particular case. So we have the intraocular lens or IOL transplant. This is going to take place whenever we end up taking away a cataract, when it's being removed, and we surgically implant this new lens structure. Now we're going to switch gears and we're going to talk a little bit about the ear. So the structures of the ear. The ears have receptors that detect pain, touch, heat, and cold, but they also enable us to hear and maintain our balance. So the kind of inner ear part is going to help with hearing and balance. Anatomically, the ear is divided into three parts. You have the external ear, which is going to be, of course, when we look here, the pinna. This is going to be the part that's going to funnel the sound in towards the ear. This leads us into the canal, which goes towards the tympanic membrane, also known as your eardrum. There's several glands in this canal that are going to produce cerumen, which is an earwax, and it helps lubricate and protect the ear and trap things if it tries to get inside. We then have the middle ear. The middle ear is behind the tympanic membrane and it contains the ossicles. These are small bones that are going to vibrate when the tympanic membrane vibrates, and it's going to amplify the signal towards the inner ear. These three bones are known as the malleus, incus, and stapes. So they vibrate. This vibration then goes towards the inner ear, where there is an oval window with the stapes. It then sends the signal into the vestibule area that is going to then send the signal to the cochlea. The cochlea is that snail-shaped type structure, and it's going to contain the spiral organs, where it's going to send the sound signals to the auditory nerve. This is cranial nerve number 8. We also see in the inner ear, there's the semicircular canals. These canals are going to be more important for balance. They are fluid filled, and as the fluid moves in different directions as your head moves, it helps you keep your balance. You'll also notice there is a special tube in the middle ear. This is known as the eustachian tube. This joins your middle ear with the nasopharynx, your throat, which normally is not a problem because it equalizes the pressure in your ears. Like when you pop your ears like that, they pop. That's what's going to equalize pressure. However, things from your throat, invaders, could get up into that middle part of the ear, and that's what causes us to get ear infections. All right, so some ear word parts that we see here are going to be the acousto or audio, which is for hearing. Oro, auricle, or odo is for ear. Cerumino is earwax. Cochleo is cochlea. Moringo or tympano is going to be eardrum. Salpingo is going to be eustachian tube, and ori is going to be pertaining to. So like auditory is pertaining to hearing. So some diagnostic tests and procedures that we're going to see for the ear are going to be using like the otoscopy. This is going to be using the actual otoscope to visualize and look at the eardrum. So this is when they check your ears at the ear doctor. An audiologist is going to test your hearing. So when I was in school as a kid, they test your hearing and they'll have you hear, if you heard the sound in one ear versus the other, you had to like raise your hand. Okay, and if it was louder or quieter, that's what they would use and to visualize and see what you could hear. They do these tests with babies as well to determine if they're able to hear after birth. We also see that you could use a tuning fork test. This is where they strike the tuning fork and you listen. There's different ways by putting it on the bones to look for bone conduction versus air conduction for hearing. We then have some ear pathologies. When we look at ear pathologies, we have anosmia, which is going to be the absence of one or both external ears. We then have otorrhea, which is a discharge from the ear. This could contain blood, pus, or even spinal fluid could be coming out through this. Ear infections are just one cause of otorrhea. Otitis media, which is a middle ear infection, like I talked about earlier when we talk about ear infections. But you can have it also otitis externa, which is an external ear infection, or even interna, which is an internal ear infection. We have otomycosis, which is a fungal infection of the ear, and a lot of times this is known as swimmer's ear because it's due to a fungal infection. Meningitis is an inflammation of the tympanic membrane. Some surgical ear interventions that we can see is a cochlear implant. A cochlear implant's a device that assists hearing by electrically stimulating the cochlea because it's not working like it necessarily should. This comes with like a type of hearing aid and it sticks to the implant that has been put in. We have an otoplasty, which is a surgical repair or reconstruction of the outside or external ear. Laryngotomy is going to be a surgical creation of an opening through the eardrum. This is where they normally will put in a tube. So when we talk about kids going into getting tubes put into their ears, this is what we're talking about. They put a little hole, they put a little slit, they put this tube, and it helps drain fluid out of the ear, getting rid of the pressure of those middle ear infections. And this is better than having the eardrum just rupture and causing scar tissue too. So some sense organ receptors we want to talk about here is that special sense organs like our eyes, ears, skin, mouth, and nose have receptors that detect different sensations. These sensations then get transmitted to the brain, but the way that they send these signals are different. So we can have chemoreceptors, which are going to receive chemical changes. These chemical changes could be things like blood glucose level, your calcium levels, any of those chemicals that take place. Okay, so they're going to detect chemical changes. Your tongue is really good with this too, because this is what detects whether it's salty, sweet, sour, bitter, that kind of thing. Mechanoreceptors are going to be for mechanical movement. These are sensitive for things like touch and pressure, so they're widely distributed in your skin. We also see that mechanoreceptors are important for hearing because of the movement that's taking place, the vibration from the sound. This is what's being used in the ear for sound and balance. Photoreceptors are going to detect light. These are the ones that are found in the eye, so they're going to detect light in order for you to have vision. Thermoreceptors are for temperature. So this is going to be detecting hot or cold, and these are also found throughout your skin as well. So nociceptors are going to be your pain receptors. They are going to detect if there's harm, injury to an area, and so they're going to help you be able to detect a painful stimuli. So we talked about the eye, we talked about the ear. Let's look a little bit briefly at the tongue. And so when we look at the tongue, guys, there are receptors present within the tongue. We call these taste buds. These are found in the papillae, which makes your tongue rough. These are going to detect not only taste, but also texture. This is why some people can have difficulty with certain textures when they're in their mouth versus just not necessarily the taste. This right here is actually a little bit misleading. They thought that this is where most of the receptors were located for like sweet is on the tip of the tongue, salts on the side, sours on the side, and bitters in the back. But more recent studies have actually shown that these are spread throughout the whole tongue. There just might be a little higher concentration of each in these particular areas. The next one we want to talk about is your nose. Olfaction is the act of smelling. So the nerve that allows you to smell is called the olfactory nerve. So this is pertaining to the sense of smell. Olfactory nerve is cranial nerve number 1. We also see osmia refers to the sense of smell. So anosmia is going to be the loss or impairment of your sense of smell, and hyperosmia is an abnormal increase in sensitivity. So anosmia is something that happened like with COVID sometimes where you're not able to smell. Hyperosmia is something like that happens with pregnant women where they have a heightened sense of smell. So let's talk about some of the pharmaceutical type of drugs that go along with this chapter. So you have the anti-glaucoma drugs. These decrease the intraocular pressure to help treat glaucoma. Ceruminolytics, which softens and breaks down earwax if you have a buildup of that. Cycloplegics are paralysis accommodation of the eye. So these act as mydriatics. Miotics, which help constrict the pupil of the eye, and mydriatics are actually to dilate the pupil of the eye. So we do see that mydriatics are used a lot of times when they say, oh, we need to dilate your eyes to look into them more closely. They would utilize that kind of drug or medication. All right, last but not least, we have our abbreviations. AD stands for right ear. AS stands for left ear. OD is for right eye, whereas OS is for left eye. Again, though, be careful on using these because we can see that there is actually sometimes where we could have a misinterpretation of what we are looking at. Again, these are not all the abbreviations that are located in your book, but these are just a few. So this chapter was a little bit shorter because it just focused in on those special senses. But if you have any questions or concerns, please let me know.